historically, healthcare has been somewhat slow to adopt new technologies, and we are seeing the exact opposite with AI, especially generative AI and the latest technologies that you're seeing in these large language models. There's some recent research that suggests that we're adopting this technology about 2 times as fast as any other industry in the American economy. So we are seeing the impact across the full spectrum of both discovery, the research, bringing new medicines and treatments out of the laboratory, and in delivery, making sure that every American has affordable, accessible, safe, high-quality care with the physician and provider workforce that we've got.
And that was Johns Hopkins Dr. Peter Najjar on this program earlier this month on our continuing coverage of AI and how it is rapidly transforming industry across the board, in this case, the healthcare sector, providing Americans with higher quality care. NewYork-Presbyterian releasing a new report highlighting AI improving diagnoses, guiding treatment decisions, and enhancing patient care. Cardiology, oncology, neurology, orthopedics, psychiatry, and women's health all seeing advancements using AI. Joining me now is NewYork-Presbyterian Executive Vice President and Chief Transformation and Growth Officer, Dr. Peter Fleischut. Dr. Fleischut, great to have you this morning. Welcome.
Thank you very much, Maria. I appreciate the opportunity to be on this morning.
Absolutely. Thank you for joining us. And tell us how NewYork-Presbyterian is using AI right now and how it may be transforming patient care.
Thank you. At NewYork-Presbyterian, this is one of the most exciting times to be in healthcare. AI is providing us the ability to personalize patient care, giving patients more time with our providers, and ultimately allowing our providers to provide the access that they've always wanted. It's also providing the capacity that we needed in healthcare. With it comes a lot of responsibility, but overall, Maria, I have to say in my whole career, I've never seen more benefits than now, and it's only going to get better. Efficiency and effective patient care, we're able to advance our people in ways that we've never been able to do before. We're going to be able to and are driving better outcomes and, frankly, more affordability. But as I said before, it really is being a need to build off of our patient trust.
And you know, I know that NewYork-Presbyterian is partnering with Open Evidence to bring AI-powered clinical decision support to hospitals and care sites across New York City and Westchester. Tell me how specifically it impacts customer care, you know, because I understand with all that data, you can really clean up the records part of things. But what about life-saving impact and the platform allowing clinicians to ask complex medical questions, receive evidence-based answers drawn from peer-reviewed research, medical literature, and clinical guidelines?
I really appreciate that question, and I love the ability to highlight, you know, just one area in, for instance, cardiac, how we're reducing the burden of disease. But before I answer it, I want to take a step back. Maria, we're seeing the ability to use AI to reduce postpartum depression, personalize cancer care, identify strokes before they're even occurring. And I'll use an example of cardiac care. We know in an hour, over 50 people could die of structural heart disease and heart failure. And we felt that this was something we wanted to take on. And so working with the world-class doctors at Columbia and Cornell, we were able to use AI so that you could be able to look at an EKG, something that's done throughout the whole world, and we could identify patients who had undiagnosed structural heart disease and heart failure. A simple, ubiquitous test that's available throughout the world. Now we were able to apply our data and apply it so that we could find out patients that would need a valve replaced, maybe a heart transplant. Now the challenge was we spent 3 years to build it. Last month we got approved by the FDA, but then we wanted to work with a partner so that we could deploy that throughout the whole world. And Open Evidence has access to over 700,000 doctors. So now they have that tool available so that they can be able to help reduce disease throughout the whole world and not just in our geography. And to me, that's the benefit of a large academic center when you can put data scientists, data engineers, world-class doctors, trainees, all in one environment to frankly reduce the burden of disease.
Oh, absolutely. And I know you served as chairman of the Department of Anesthesiology at Weill Cornell Medical College. How do you see AI changing the field of anesthesia as well?
I did. As in my role at the Department of Anesthesia, I've saw many advancements in the ability of AI. As I said, a lot of things happen outside the operating room. We were able to identify how to reduce risks ahead of time with perioperative care. We were able to, and still continue to, think of other ways. How do you personalize dosing for patients in the operating room? How do you look at real-time data so that you can identify events that may be occurring? We were able to pull together, when I was vice chair of the department, the ability to bring a data scientist from Cornell Tech and a data engineer, and we were able to use real-time data to identify events that could be occurring 30 minutes out in an operating room. And the anesthesiologist sits in an OR, and at any given moment, they have over 180 pieces of data coming at them. And when you can use AI, you can surface that to those doctors to better take care of patients, both before, during, and after their care.
That is awesome. What a moment to be alive, doctor. I mean, what about the biggest killers out there? Heart disease, cancer. Is AI changing outcomes or helping to change outcomes?
Absolutely. It's preventing risks. It's allowing us to reduce variation in care. It's allowing us to advance and care for patients the way that we've always wanted to. And Maria, the most exciting thing is at NewYork-Presbyterian, we're not just trying to also treat disease, we're trying to cure disease. And we're doing it. There's probably 7,000 diseases that we don't even know about that affect hundreds of millions of people. And now with the accelerated ability for drug discovery, like we saw yesterday in the FDA, and the ability for accelerated diagnosis, we can be able and are curing diseases like sickle cell disease, thalassemia, pediatric deafness, pediatric blindness, and even soon cures like type 1 diabetes for children. And we're going to be able to do this in an accelerated way to not only have more treatments, but to accelerate the delivery. And that's why I think it's the most exciting time in healthcare.
Absolutely. Love it. Dr. Peter Fleischut, thanks very much for walking us through it. Great to have you this morning. Come back soon, sir.
Thank you.
All right. We'll see you soon. Stay with us. Quick break. You're watching Mornings with Maria live on Fox Business. Stay with us.